Welcome back to my channel. Today we'll discuss about an important topic regarding grid. In 1913, Sir Gustav Baki invented grid. So what is the main function of grid? It removes scatter radiation. Okay. And it improve contrast. So actually in X-ray, how it is placed. Suppose this is a X-ray source. This is a source, and here is the patient. This is a patient. Okay, and this lies your cassette. This is your cassette. Okay, and here lies the grid. It is made up of aluminium and lead. So from the source X-ray comes, and it primary radiation is goes to the cassette. These are the primary radiation. But when the X-ray hits the patient, it produces some secondary radiation. That secondary radiation is obstructed by this lead. Okay, the secondary radiation is obstructed by the lead. Only the primary radiation passes through, thus improving the contrast. Okay, so what is grid? If I say in one word, it removes secondary radiation and helps to passes primary radiation. That is the basic function of grid, thus improving the contrast. Types of grid. There are two types, linear and crossed. What is linear? You see the linear grid. This is a linear grid. The linear grid focuses in a convergent line. This is a convergent line. But what is cross grid? When two linear grids are kept parallel to each other. And that focuses in a convergent point. This is a convergent point. Okay. Now, how a grid is made up of? You see this grid. In a larger view, this is a grid. Okay, I'm again drawing it. So these are the lead strips that prevents the secondary radiation. This is made up of lead, and this is made up of aluminium. Okay, if this width is small d and the height of the lead is h, then grid ratio equals to h by d. Okay, this is called grid ratio, the height of lead by width of aluminium. More the grid ratio, there will be more contrast. Okay, normally grid ratio ranges from 8:1 to 12:1. Now there are few factors that determine the grid performance. Number one is primary transmission. What is primary transmission? Ability of a grid to transmit the primary radiation. Okay, how does it calculate it? It is intensity with grid by intensity without grid. That is calculated primary transmission. Next is Backy factor. It's very important point. Number 2 is Backy factor. Backy factor, what is Backy factor? Is the ability of a grid to remove both primary and secondary radiation. How is it calculated? Backy factor, it is contrast. Sorry, it is not that. It is incident radiation by transmitted radiation. Is Backy factor. B for Backy, B for both. That is it. B for both means ability to remove both primary and secondary. It's Backy factor. Incident radiation by transmitted radiation. Number 3 is contrast improvement factor. Okay, it is the single most important point for a grid because the main function of the grid is to improve the contrast. If a single point to consider regarding the performance of the grid, it will be CIF. How is it calculated? Contrast with grid by contrast without grid. That is how it is calculated, called contrast improvement factor. Now there is a point called grid cutoff. What is grid cutoff? Grid cutoff means when you use a grid and if it is wrongly used, then its impact will go direct into the cassette. and the film will be deformed. That is called grid cutoff. There are 4 types of grid cutoff. Okay, what are the 4 types of grid cutoff? Number 1, focused grid, upside down. What is that? So as we have seen that when you use a grid, it has a 2 surface, this surface and the surface bottom. Okay, because the 3D structure, and there is a source. If we use a grid upside down, मतलब अगर उल्टा यूज करते हैं, then what will be the case? In the film only the center part will be exposed. Okay, periphery will not be exposed, only center part you can see the picture. This is the number 1. Number 2, focal distance decentering. That means if we place the grid beyond or near to the convergent line or point, then this is called focal grid decentering. Okay, so in this case also there will be only the center part will be exposed. Then number 3 is the lateral decentering. What is lateral decentering? Here we have seen previously that there is a convergent line or convergent point for a grid. Okay, but if the XF source is lateral to that convergent line or lateral to the convergent point, then it will be lateral decentering. In that lateral decentering, there will be a uniform light film. Okay, how to remember? The light film, L for L, decentering. Lateral decentering for light film. Okay, and then the number 4 is combination of lateral decentering plus focal distance decentering. That combination of 2 and 3 will cause one side black and one side white in a film. And this combination of lateral decentering and focal distance decentering we most commonly found in any film. Most commonly we can find this. So to summarize, what is the grid? It removes the scatter radiation. Okay, it removes scatter radiation and improve contrast. Okay, this is the main advantage. Now what is the main disadvantage? As we use the grid, we have to increase the patient dose. The amount of X-ray that is coming to the patient, that is the patient dose will increase. Okay, that is the main disadvantage of using So I hope you have understood some basic about grid. I will next see you in the next class. Thank you.